Okay, let's talk about why it is important to talk about focus. Two or three things. One is 50% about your concentration, about your focus. When you focus, it's a 3 hours, listening, reading, and writing. 3 hours. It's a long paper. You have to conserve your energy, like here you are at 100%, then maybe here you will be at 75%, and then here you will be at 50%. I suffered it, okay? I hope you don't. Like I got 450 in this, uh 450 in this, 410 in this, 370 in this. Because when I came to the reading point, I was totally exhausted. I could barely finish it. So I wish somebody told me this earlier. We have to conserve our energy. We have to rest at every second that we get, and we have to, like those yoga guys, inhale and exhale, something like whatever you do to relax yourself. We have to relax. We have to conserve our energy, conserve energy, focus, willpower, and every one of those good qualities, it's very important, and you are going to realize it's important when you get out of the examination. I'm sure you have realized it up till now because you are a doctor, aren't you? Let's talk about how to maintain your focus and listening, because I am not blessed enough to have a very extended span of concentration and focus. I don't have that, and I'm sure you don't either, because we are mediocre. Genius and dumb people are rare. One of our teachers used to say that, and I believe it. So if you're like a mediocre, like me, and you have a hard time focusing in the concentration or reading part, like you are listening to the audio and you don't know where the speaker is going, like you're focusing on one point, the speaker is moved on to the next question. If you're like that, so I'm going to try to explain it here. First of all, I have three tricks for you, okay? Like three tricks. How to get extra time, okay? Extra time. How to do that? Well, it's a stupid thing to ask, but hey, you can get it, okay? Second, when can you take rest? When can you rest? Because we need to rest. If we have some rest every 1 or 2, just for a 1 or 2 seconds, we can focus extra hard. And when you have to be extra vigilant, okay? So let's do this. Three things, right? So, here we are, paper A. So, there we go. Let's talk about number one, extra time. Well, you get the extra time when the speaker is trying to explain the paper to you. Like, the speaker is going to speak all of this. In this part, you will hear this. The speaker usually speaks for like 15 seconds. You get this in the beginning of part A, so you can use it on your extract 1 in part A. And then in part B is not that useful because you can use that extra time on just one question. But if you read, okay, but in part C, it's very important part C, and we will explain it how. Anyways, here we come to the paper A. So I have explained to you how to get the extra time, and I'm going to explain it more in the part C. So let's begin. Like, first thing is this. The second thing, when to take rest. Let's talk about the resting period. Look at this. Okay, so you get 30 seconds in the beginning of this part A, extract A. part A and the exact one. In those 30 seconds, don't read the paper. Don't just start reading it. Don't do that. What I'm going to try to explain is that you have to scan it. Just rapidly go through it. If you are on the computer, just scroll it, and if you are on the paper, just rapidly scan through it. What you have to look in that time. Let's talk about that. Number one, look where you can take rest. Like for example, here, rest one. Like here, rest two. You might ask how? Because these are hints. When he is speaking, you are just looking at them, and you are like, okay, he's here, he's here, he's here. You're not focusing. When he comes here, you have to focus very hard. Okay. First thing is this. Okay. Do you get it? What is first point? Resting periods. Okay. Second point, where to get extra vigilant. Okay, so let's make it purple. Extra vigilant, purple. Okay, extra vigilant, you have to be extra vigilant here. Why? Because two questions and there is no space between them, there is no hints between them, and then you have to, this is a very dangerous place, this here, you have to be extra vigilant, like one, two, three, four, like oh my god, there is no hint between them, and if you miss this place, like for example, if you miss this one, you won't know whether the speaker has reached this place, or the speaker is still here, or the speaker is still here. You are going to lose it all. Okay, and obviously you are going to get anxious, and that is going to be detrimental for you. So what we learn, the second point is, oh sorry, second point is extra vigilant. What is the third thing that you have to focus on? I think most of the people don't talk about it, like how important it is, and that is, you have to focus on these points, this. Like why? Because you are going to focus, like you are focusing on this, you have to keep this in mind, because when the speaker says, okay, Mr. Ray, would you like to tell me about your symptoms, you know that the speaker has shifted to these points. When he says, would you like to tell me about your occupation, you know the speaker is here. Like for example, you lose the speaker somewhere here. Okay, now you don't know where the speaker is. For example, you miss the speaker here, but then the speaker says, were you referred any place? Now you know that there is a part where they're talking about referral, and you immediately come here. It's a very important thing, and you are going to realize that how important it is. Okay, so there are three things, and the third thing is headings. Okay, so first was rest, there. Second was extra vigilant, like there and there. Third was headings. Okay, like this. That's paper A. That's how you do it. Okay, now I'm going to give you one hint on like how you can make yourself extra efficient. Okay, let's get here. Okay, extra vigilant. Like rest. A little bit of rest here, like this place you can rest exactly, but let's talk about how we are going to practice this paper. Okay, don't just blindly go in and start the audio and just like everybody does. Don't do that, because we cannot concentrate, so we have to work on our concentration. So how I'm going to tell you how. So you have played the audio, you have started it, you have attempted this question. Okay, you have attempted this question, you have attempted this question. What you will do, you will mute the audio here, mute for 1 2 3 4 5 seconds, for example 5. It's up to you. 5 seconds, turn it on, turn it on. You don't know where the speaker is now, obviously you don't know. So now listen to the speaker and focus, or try to, relocate or juggle your memory, because I just told you we have to remember these things. We have just like, we know there is a bit of a medical history, and so when you will turn it on, you won't exactly know where the speaker is, because like you may hear he's talking about left hand, so you quickly know, okay, he's here. Or maybe he's talking about health, general state, so you know here. But even if you don't get it, whenever when he will say that, is there anything significant in your medical history, you immediately know that the speaker is here. What this will do is that it will make your concentration span a very, very, you will get very efficient in it. Trust me, it's going to work with you in part B and C as well. So that's just about it for part A. So let's get to the part B. Like, here you get the extra time. Okay, this is the extra cheese for the pizza, extra time. Okay, but it can be utilized in only this part, so it's not exactly useful in part B. But extra thing is extra, never ever say no to a free thing. So you read this, you hear a nurse briefing her colleague about a patient. We don't care about it. What does she warn her colleague about? Yes, we are very this warning. We have to focus on what does she warn about. Underline the warn, okay? Read first option, read second option, read third option. Then you have to focus. Did you underline the right thing? Like, is the question actually about the warning? If it is, keep it underlined. If it is not, just do this and underline the second thing and read the options again. So what we will do, we read this. You had the manager of a care home for elderly lady to taking to the nurse. You don't care about this because the question won't be about it. So the question is next. He says that the error in dispensing medication to patient usually result from. So the error in dispensing medication, that's very important. Okay, because here it is about administration. Oh, I don't exactly know the audio, so I'm just speculating here. Okay, so a failure to check the patient, like it's not about administration, so most probably this option is going to be wrong. Okay, this way. So underline the dispensing. You read the first option, you read the second option, you read the third option. Now you know that the third option is not exactly okay, so you can just mark a little cross here and then go back to the statement again. Make sure that the question is about dispensing. If it is, underline it and go through these options again. So what we are doing here, reading the question first, reading the options, then reading the question, okay, and reaffirming that we have underlined the exact correct thing, and then reading the options again. So this will strengthen our short-term memory. I don't know if that's how it works, but this will, it's like repeating your short-term memory, and that will help when the speaker starts. Once you do that, your time is up and the speaker will start speaking. So I hope it's going to work for you, and I hope that it works because it did for me. Let's move into the part C. The part C, the most difficult part for me at least. Okay, here we go. What is this, guys? Extra time. Oh yes, extra time. The speaker speaks. We don't care. We care about this. So as soon as the start, this is extra time, guys. Use it. So here is a very strange strategy that I use. So what is this? You might ask. Well, how many questions there are? 1, 2, 3, 4, 5, 6. I am going to cross these two questions. Why? Because I am not smart. Because I cannot concentrate long enough. I can hardly manage my concentration for the first 4 questions. So if I can mark 4 out of 6 correct, well, isn't that something? I have to get 350, right? So let's not focus on these two. So what we will do, we read the question, why does Dr. Robinson regards Chagas as a neglect disease? So what is the focus here? Neglection. Underline it. Read the options once. Okay, we read the options. Next question, Dr. Robinson, the concerns over Chagas in the US. The USA, the concerns. Underline it. Read the options. A patient called, okay, Marisol. Whenever there is a patient's name, that is very important. Underline it or highlight it if you are on a computer. Read the options. What problem does Robson identify in the case of patient called Jennifer? Okay, here it goes, Jennifer. Okay, so what is going on? What we are why I have highlighted it. Okay, there are two ways the part C comes. One is that it can be an interview. Like if it's an interview, it's easy for you. Why? Because when they ask the next question, you know that they have shifted to the next question. But if it's not an interview, you are in trouble. So it's for that trouble. Because why? You in your back of your mind, you know there is USA, there is concern. You are listening to this question, and as soon as they say US are concerned, your mind immediately shifted to the second question. You know that they have moved on. If you have not attempted the first question by now, leave it. Okay, move to the second. But if you follow this strategy, you won't have to do that. You won't have to miss a question. So what we did, we read the four questions one time, and now we still have time. We are not going to read the fifth and sixth question. What we will do, we will move on to read these questions again. Okay, we have read the first four questions twice, and their options obviously twice. So what we are doing, we're strengthening our short-term memory, we're repeating, and that will help us maintaining the concentration when we are listening. What actually we are doing here is that we are memorizing these things so that when we are listening, our mind is actually focused on the listening part, and we are not shifting our concentration between listening and reading, and listening and reading, because somehow these are little bit memorized in our memory. Okay, we are focusing more on the listening part. And so hopefully you'll correct these four questions. But let's say there is a scenario you are a little bit unlucky, and I hope that's not the case, but suppose you have read it first time, first time, first time, first time, first time. Four questions done. We are on the second run, second time. Well, while doing the first run, we came to know that this is a difficult question. Okay, so it's a difficult one. It's a bad thing. Okay, it's a difficult one. Okay, so what we will do on the second run, we're going to miss it. Okay, we miss it. Why? Because we don't want bad things in our life. Miss it, guys. Okay, save your time. We do this, we shift to the question 3, then the 4, and the time that we have saved from here, we move it to the question 5. Does that make sense? Why? Because we cannot waste our time on a difficult question. We will move on to the question number 5, okay, and we will focus on it, and that's it. 4 questions out of 6. And obviously now these 2 questions, we are not going to obviously make them wrong or something. There's still a 50% chance that we might correct it, and trust me, it works out. I scored 450 on listening. Okay, so that's how I did it. I hope that's quite helpful. Okay, one very important thing, I forgot to mention this thing earlier. The most important thing, there are 2 strategies of attempting these questions. First is choose the best one. Choose the best one. It's not a good strategy. No, not for us, because we're not smart, right? Well, not hyper smart. Obviously, we're smart with doctors. So what are we going to do? We are going to do a thing which I call exclude the wrong one. Like, how is this gonna work? The wrong one. Okay, let me show you how to do it. Here we go. So let's just do it. Okay, let's move to the part B. This is especially useful in the part B. Okay, here it is, the part B. Sorry, I forgot to tell you before because I had forgotten it. It's especially useful in part B. Okay, so how it's gonna do it, how it's gonna work? Well, what we can do is that exclusion criteria. Exclusion, what we are going to do, like in computer, you have the option to cross the wrong ones in computer, but in paper, what you can do, you can just do this. You have read this question, like for example, you hear a doctor talking to a teenage boy about a painful wrist. Okay, the doctor wants to establish whether you have read a fracture may be misaligned this. Now the speaker speaks, and obviously you are going to know, okay, this is not true. Like for example, he says that a fracture may be misaligned, okay, but the doctor says the fracture is perfectly aligned. You know that this option is wrong. You now have two options. So at the end, you have to decide between these two options. And sometimes there are two options which are exactly wrong, and you are left with one option. This is a better way. Don't just straight go to the most correct option. Exclude the wrong ones first. Okay? Exclude the wrong ones. Yes, that's it. It's very important in reading part B or C and all of that. So I hope this helps. If you have any tricks up your sleeve, do tell. And if you want to ask anything, you can ask me anything. Or if you have any suggestions on anything, just ask away. Hopefully, this will be helpful. Remember me in your prayers, guys.